Congressman Troy Carter held a roundtable discussion today on obesity and mental health concerns.
As Sabrina Wilson reports, healthcare professionals say both are diseases.
We're convened in a room, but we need to make sure that we take this back out so we don't perpetuate the same issues of stigma with mental health and obesity.
Congressman Troy Carter brought healthcare professionals, patient advocates, and others together at Xavier University to discuss obesity and mental health issues and to work on solutions.
But to create a comfortable place to say, not go lose some weight, go exercise, put the Twinkie down. Let's talk about what's happening with you. How can we help?
According to the NIH, numerous studies have demonstrated a positive association between obesity and various mental health issues, including depression.
There's absolutely a correlate, because every time you look in the mirror, not only is there shaming by the community, we shame ourselves based on these ideologies, these ideal pictures that people put on social media.
Dr. Catherine Hudson, an LSU health physician and director of obesity medicine at UMC's Weight Loss and Bariatric Surgery Clinic, was also at the table.
We need to figure out how to empower our patients to advocate for themselves as we move forward with creating programs to treat both obesity and mental health, and legislative agendas, moving forward with legislation on treating obesity as a disease, which it is.
She points to barriers to treatment.
First, there are barriers within the patient themselves. They believe that this is something they've done to themselves and they don't deserve treatment sometimes.
And
so right now, if I see a patient in my obesity clinic, I will not get reimbursed if I try to bill for the diagnosis of obesity, despite obesity having been a disease per the AMA for at least 10 years.
Ava Zebrick is with the Obesity Action Coalition.
You need to expand the access to care for obesity.
She shared her personal journey.
So I've been affected by obesity since early childhood, and in my mid-20s, I found myself at that time weighing 300 pounds, and I had a myriad of comorbidities with obesity. I had hypertension, high cholesterol, prediabetes. I did suffer with pretty severe depression.
But in order to conquer them, we have to talk about it.
And they stress that obesity and mental illness are not things to be ashamed of.
I did experience a lot of shame and thought that I was to blame for the state that I was in. And
Dr. Hudson says anti-obesity medications like Wegovy or Saxenda, which she said are branded versions of medicines like Ozempic and Victoza for diabetes, are game changers and indicated for treatment of obesity as a disease, but not meant to be used for vanity weight loss. Meanwhile, Congressman Carter says people can call the 988 crisis hotline 24/7.